All right, good evening, everyone. Welcome and thank you for joining us. My name is Carrie McBain, and I am a member of Down Home, North Carolina of the Jackson County chapter, and I am so grateful for all of you for turning out tonight. I am here today because I was recently diagnosed with diabetes. I've been working my whole adult life, but I don't have health care. I make around $80 too much to qualify for Medicaid, and I fall in what we call the coverage gap. The issue of expanding Medicaid is near and dear to my heart because there shouldn't be a price tag on my life or the life of any of my neighbors in North Carolina.
Oh, see what happened?
We're unplugged.
All right. The members of Down Home, North Carolina decided to sponsor this event today because we know that this is something that we can all agree on because we all share the same values. This is not a Democrat solution or a Republican solution. It's about saving lives like mine. We are joined by the NAACP chapter of Haywood County, the Poor People's Campaign, and Indivisible Common Ground OFA of WNC. All of these organizations have one thing in common. We love our neighbors and want to see everybody have a fair shot at a happy and healthy life. You can find information about all of those organizations at the tables, at the doors, in the back of the room. Some quick housekeeping stuff. The bathrooms are located down the hallway, which is behind you through those double pane window doors, and on your right. If you have any questions or comments, please hold them until the appropriate time. You will have 2 minutes to ask a question of anyone at this event or to make a comment. If you need any help at any point during the event, look for the folks wearing a Down Home t-shirt or button. Tonight we will open with a prayer by the Reverend Jocelyn Schaefer of Grace Church in the Mountains. Then after that, we will hear from a panel of speakers, including our neighbors Lynn Carver, Leslie Hooper, and health professionals Dr. Steve Wall and Jonathan Bentley, who's an FPN, and Down Home member Rhonda Cole Shandaba. We will then read aloud statements from our legislators in Raleigh regarding this subject, before opening the floor to any questions or comments from the audience. Now, before I turn it over to Schaefer, I'm going to ask you to do one thing. When I say, what do we want? You say healthcare. So, what do we want? Healthcare! All right. What do we want? Healthcare! All right. Now, when I say, when do we want it? You say now. When do we want it? Now! When do we want it? Now! All right. Now, whoops. I think I cut that a little short. I'm sorry. But anyways, the purpose was to make sure that we all want health care.
Chelsea, turn it over to Jocelyn. What? You can turn it over to Jocelyn.
Oh, I was trying to say something else.
Anyways, here's Jocelyn.
I'm really honored to be here tonight, and I just wanted to share briefly before we pray that our family benefited from Medicaid, and I might not fit the average profile. I had graduated from a top-tier liberal arts college, had a master's degree. My husband had just graduated from law school and was unemployed. I worked as a social worker where I did not make enough to have health care for myself, and I had a baby, and so my little boy received Medicaid benefits for the first year of his life, and we were so grateful for that. So I am really committed to Medicaid expansion. I'm also mindful that today is the first day, or the second day, of the great 50 days of Easter. So for Christians all around the world, we're celebrating resurrection, we're celebrating the promise of redemption, and at our church anyway, we renewed our baptismal covenant, and one of the questions in that covenant is, do you promise to respect the dignity of every human being? And healthcare is certainly one of the basic human rights. And so I'm very happy as a Christian to be advocating for that tonight. I will be offering a Christian prayer, but please know that it's with great respect to all religious tradition for those of you who have none. If you're willing, let us pray. Lord, we know that you hear the cries of the poor. The first stories that we've told about you were of you rescuing slaves out of Egypt and bringing them into the promised land. Time and again, you called prophets to proclaim the day of the Lord, which is the day of justice, the day where the rich share with the poor, the day when people open their eyes and recognize there is enough bread for all. We ask this day that you would turn the hearts of stone that are around our nation, and probably each of us have at least a pebble or two in our own hearts, that you would shift our hearts and make them hearts of flesh, so that we, like you, are moved by the cries of the poor and are willing to share our bread, our bounty, our wisdom, our passion, and our resilience with all of your children. We ask this in the name of the one who came to us as an uninsured refugee child, Jesus. Amen.
Thank you everyone for being here today to talk about something near and dear to the hearts of many of our neighbors in Western North Carolina. My name is Katie Ballou. I'm a member of Down Home, North Carolina, and a student at Western Carolina University. I'm here to bring you up to speed on why Medicaid expansion is a big deal and what it means for our community and why it matters to us. When Down Home in North Carolina first hit the ground running in 2017, we asked hundreds of our neighbors in Haywood and Jackson counties what issues mattered most to their families. Healthcare came up as number one across the board. 2 years later, we are in the position where our state still has over 1 million individuals suffering without access to health coverage. In Western North Carolina, there are thousands that cannot afford the care they need without coverage. We have called this town hall because it doesn't have to be this way. Many of us have heard of Medicaid, a government health insurance program that offers coverage to low-income families. Many of us have also heard of the healthcare marketplace, part of the Affordable Care Act that allows individuals to purchase their own health insurance coverage. But not enough of us have heard about the Medicaid gap, even though many of our neighbors are experiencing it firsthand. The purpose of the Affordable Care Act was to provide all Americans with affordable health insurance. Two key pieces that make this law successful are the availability of subsidies to assist individuals with paying premiums for marketplace plans, and the expansion of Medicaid coverage to people earning less than 138% of the federal poverty level. The Affordable Care Act passed more than 9 years ago, but to this day, politicians in North Carolina's General Assembly have refused to accept Medicaid expansion, leaving 500,000 of our neighbors without health care. These individuals, like some of the folks you will hear from today, fall in the coverage gap. They are between a rock and a hard place. They do not meet the categorical or income limits to qualify for Medicaid, yet they also do not make enough money to afford insurance on the marketplace. Their jobs don't provide health insurance, and no other public programs make coverage available to them. Without health coverage, they risk serious illness, early death, and debt. Most people who fall within this gap are working, more than 60% of them, but they don't get health care benefits from their employers, or they can't afford to purchase health insurance on their own. These hardworking folks are self-employed or work in industries like retail, construction, food service, and childcare. For example, adults who earn between $737 a month and $1,674 a month for a family of 3 are in the gap and are currently left out of both Medicaid and ACA subsidies. That sounds like most of the people I know. In Haywood County alone, 2,579 people would have had insurance over the last few years if our state government had chosen to expand Medicaid. For the 7 Far West counties, the number of people who deserve Medicaid but can't get it is 9,346. And while our neighbors aren't receiving Medicaid, all of us are paying for it. Since 2010, thanks to politicians who refuse to expand Medicaid in North Carolina, our tax dollars have been going to other states instead of coming back to North Carolina to ensure that our neighbors have health care. Not only are our tax dollars providing coverage in other places, but we are losing out on jobs and billions of dollars of revenue because our government won't do the right thing. Medicaid expansion would create 43,000 jobs in North Carolina, 13,000 of those in rural communities just like ours. Not to mention the $238 million in business activity and over $2 million in tax revenue that would generate in our far west 7 counties through Medicaid expansion. It doesn't make sense to not expand Medicaid for the folks of North Carolina. Our community is experiencing the consequences of what happens when we don't expand health coverage to our neighbors. The opioid crisis will continue to get worse since not having insurance is the #1 reason why folks struggling with dependency aren't seeking treatment. Our hospitals have to eat the costs of providing services to folks that don't have insurance and can't afford to pay their bills. When the hospitals can't keep eating the cost of those services of those that don't have insurance, they can't afford to pay their bills. They lose services, they close, and rural communities lose jobs and the services that they provide. 5 rural hospitals have already closed since our state refused to expand Medicaid. Pregnant women in Macon County or Spruce Pine now have to travel over mountains in order to safely give birth in a medical facility. This year, our representatives in the General Assembly will have the opportunity to vote to finally expand Medicaid. Unfortunately, many of our representatives still can't find leadership to support clean Medicaid expansion and are either opposing it or attaching barriers to care, like premiums and work requirements. Through this town hall and Down Home North Carolina's work this spring and summer, we can make a difference and win Medicaid expansion for our communities, our neighbors, and more than 500,000 North Carolinas living in the gap. Today, we are going to hear from some of our very own neighbors, hardworking folks that don't have access to affordable care they need. We are going to hear from health professionals about their firsthand experiences in the field and the impact that Medicaid expansion would have on the lives of the people they serve. Finally, we are going to hear what we can do to fix this. Please join me in welcoming our panelists, starting with Down Home's very own member, Lynn Carver.
There have been periods of time over the past 9 years that I've been unemployed. When you have no income and you can't be sure you'll make enough money that year, you can't qualify for the ACA. And since I'm single, non-disabled, in my late 40s, early 50s, I didn't qualify for the Medicaid since North Carolina didn't accept the expansion. COBRA, by the way, that my employer offered was $1,600 a month, and I had 0 income and no savings. My body didn't care. My diabetes didn't say, hey, I get it, I'll go on hiatus until you can afford insulin again. Nor did my thyroid disease, high blood pressure, sleep apnea, asthma, or any of the other chronic illnesses that necessitate the 25 different medications I have to take. Last year, my insurance paid out over $10,000 for my medications. That's almost half my adjusted gross income for last year. So while I had no income, I had to leave my long-term primary care physician and go to the free clinic. That meant transferring records, including prescriptions. That meant a new provider with different ideas on what I should take. And that meant changing up meds to avoid interactions. It also meant using the pharmaceutical company patient assistance programs to get free diabetic medications. You've all heard about how expensive insulin is. That includes delays, changing hands. We got the insulin or the medication assistance person at the clinic, and you've got the pharmaceutical company representative, so there's postal delays. I had to delay seeing my Asheville endocrinologist because I didn't have the money to pay for gas to go to Asheville or to go to the visit itself. Bills piled up, and my family could only help so much. So I had to pick and choose what medications I needed to refill. Blood pressure or thyroid? What would hurt me less right now? If I go too long without my blood pressure meds, my heart risk goes up. So maybe this month I'll get that filled. I do without all of those that just made my quality of life better, like being able to breathe. My allergy meds and expensive asthma inhaler. I go months with just hoping I didn't have an allergy or an asthma attack. Replacement CPAP equipment. So to track this, all of this, when did I get it last filled, I started putting it in a book because there was absolutely no way I could figure out when I got something last filled if I didn't have it all tracked. So what I really needed was stability and continuity of care. My body didn't stop needing these medications. Every med I did without meant damage was being done to my body, maybe irreversibly. What if I were on Coumadin, a blood thinner? Surely a lot of us know someone like that, right? A day without Coumadin means they could have a stroke and die. Medicaid expansion would have let me keep my provider, take all of my meds, ongoing with no gaps in care, stay healthy enough to keep looking for another job, because it's really hard to look for another job when you can't breathe well, you don't have your thyroid medication, you're really tired. We already paid for this as North Carolinians. It won't cost us more money. We need to hear our elected leaders say clearly that they support Medicaid expansion and will do something about it this session.
Thank you, Lynn. Very scary. My name is Leslie. I live over in Swain County. Insurance coverage is something that I've been without for a couple of years now. Let me back up a second here. 2019 got off to a very amusing start. Right at the 1st of January, I had a little episode, and we suspect that I may have had a TIA. I already had an annual appointment scheduled for a week or two later, so I waited and thought I would just talk to the doctor about it then. When I got there to the doctor's office, they told me we could talk about the problem or we could do my wellness appointment. We cannot do both. I was absolutely flabbergasted and speechless. I decided I would opt for discussing the problem, and we rescheduled my wellness appointment for next August, so hopefully I'll be okay till then. I couldn't believe it. And I changed jobs back in 2017. I had been working for an employer that did provide healthcare coverage. The new job did not have healthcare coverage, so I got enrolled through the ACA, and my monthly premium was about $240. I had either $3,200 or $3,500 deductible. I did have wellness, so that first year, I felt okay. I was hoping nothing ever happened, and it didn't. I got a letter that fall telling me that my insurance premium, insurance premium for 2018 was going to double. It was going to be $488. There was no way I could afford that, so I figured I would just take my chances and get penalized, with my tax returns and stuff. But had a friend of a friend that worked for Farm Bureau, and he was able to get me enrolled with no monthly premium, but my deductible is now $7,000. I got last year's letter on what my premium would be this month would be $1,100. I definitely cannot afford that, so I am still under my little no monthly premium and $7,000 deductible plan. So I have had a couple of tests to try to determine if I had a TIA in January or not. I've spent $545 by the end of March. We're still not sure, and I think I will just hold off on getting any more tests done for the time being, and just see, how things work out and stuff. I can't imagine what would happen if I had $7,000 worth of medical bills, on top of everyday living expenses and stuff. It would be non-existent. And I appreciate this program and the work that people are trying to get done to get health care coverage for everyone, affordable health care coverage. And with that, I appreciate it and thank you.
Thank you. And thank you down home for this program. I'm Steve Wall. I've been a pediatrician in this county for about 30 years. And when I moved here from Texas 30 years ago, North Carolina had a great reputation for innovative healthcare for children in particular. And that's been somewhat eroded over the last 5 or 6 years with a philosophy of trying to privatize children's health programs, Medicaid and health choice. And so far, Governor Cooper and Mandy Cohn, who is the commissioner in Raleigh, have both kind of stood their ground and have created much more of a publicly responsible option to maintain Medicaid for children. My practice takes care of about 5,000 children in Haywood County on Medicaid, so I've had a lot of experience. And so Medicaid, which of course goes back to 1966, and Children's Health Insurance Program, or CHIP, or Health Choice as it's called. This is a program Hillary Clinton pioneered in the 90s. These two programs have really stabilized healthcare for the vast majority of children in Haywood County. There are still plenty who fall through the cracks, unfortunately. But overall, that's been a positive thing which we want to preserve. The biggest problem with children's health care in the county is mental health. And I'll get to the opioid crisis in a second and how it affects children. But even with children who need mental health services, there is a real shortfall. And Medicaid expansion, as it has in other states, would help us promote programs and develop programs that, frankly, would help children gain access to therapy of various kinds, and it would decrease our reliance on medication. What happens is when children come to us and they're being thrown out of daycare at the age of 3 or out of kindergarten or 2nd grade or fighting or violence in high school, they need to be in therapy, really pretty responsible and comprehensive therapy. And when we can't access that, there's a lot of pressure to prescribe medication, which I think could be somewhat avoided and lessened if we had Medicaid expansion, which would then allow us to get more therapists, more mental health services, which is really what we want to have instead of the over-reliance on medication. The big problem that we see is more with the parents. And every day, literally every day, I will see patients, children being brought in by foster care, by DSS, or by grandparents or great-grandparents, because the parents have been felled by the opioid crisis. Recently, I had a 2-year-old brought in by DSS who had spent the day in the living room of her house trying to revive her dead mother, who did not have medical care, who had died of an overdose. The child's 2 years old. It's hard to say what kind of traumatic after effects this will have for this child's life. But again, the lack of Medicaid access and medical care access and rehabilitation access is wreaking havoc in our families in this county. We see large numbers of children who are in custody because the parents have not been able to access the care that they need. In addition, besides mental health issues and substance abuse issues, we see children all the time who are just very, very scared about their parents' illnesses. When a parent can't take care of their health, it affects the children. And we see the anxiety and depression that children face when they see their parents suffering and can't get access to medical care. This is just a tremendous cascade of effect. We see a lot of children coming in with PTSD. Either they've been exposed to domestic violence because the parents haven't had access to medical care and psychiatric services. There's domestic violence, there's just all kinds of different phenomena that really tell on the children, and they end up needing services. So the expansion of Medicaid helps children, even children who are getting their Medicaid, because it helps their parents. We saw in Ohio where the opioid deaths from opioids in Dayton, Ohio have been cut in half. And the governor, the Republican governor, Kasich of Ohio, said the reason this happened is Medicaid expansion, cut in half within 2 years. So we need to really emulate that. A couple of other issues. I've seen families who actually can't get married they've been living together, but they can't get married because they'll lose their insurance, because then their joint tax return would then disqualify their children for Medicaid, or the mother may be on Medicaid for a year having been pregnant or delivered. So the laws are so backward, they actually prevent families from forming and thriving. There are also tremendous issues with eligibility. People get confused about Medicaid, they get thrown off, they get taken back on. And what's happened in the country as a whole is, and this is important when we push for Medicaid, we call it clean Medicaid expansion. We don't want a lot of red tape attached to a Medicaid expansion bill. For example, in Tennessee, 155,000 people have lost Medicaid, and to get back on, it's a 98-page form that is given to people. This is insane. So 55,000 children in Tennessee lost Medicaid last year. The vast majority, over 80% of people who lose it eventually regain it, but it takes a year or two to get back on it because of the obstacles that are put in the way. So this is a tactic that's being used to save money. The state of Montana was very thrilled that they're going to save, Missouri, $200 million a year by making the red tape about Medicaid harder for people. So we need to watch out for that in North Carolina. When we expand Medicaid, which we have to do, it needs to be a bill that really doesn't put more stress on families, as unfortunately has happened in Tennessee and some other areas. So I think that's really all I have to say, because again, we're very fortunate so far. The children in Haywood County are getting access through Medicaid and Health Choice, or the Children's Supplemental Health Program. But they do suffer tremendously as their families suffer. So, thank you.
Thank you, Steve. Thanks everyone for being here, and thanks to Claudette and Carrie for inviting me to be here with you tonight. Otherwise, I might not have known about this event. So for all of us, if we get a chance to reach out and tell people around us what's going on, it gives a better chance that we're going to get a groundswell, the groundswell that we need. The reason that I'm here tonight, besides not having to work tonight, is that I've had the opportunity to see the before and after, the good stories about what happens when people who previously didn't have access to health care, when they get access to health care and it turns their lives around. I'm a family nurse practitioner. I'm one of the providers at Blue Ridge Health Jackson, which you may recognize that name because the Good Samaritan Clinic of Haywood County and the Good Samaritan Clinic of Jackson County, both independent free clinics, morphed into federally qualified health centers, FQHCs. And those now see a lot of the same patients that were going to free clinics. Free clinics served thousands of patients and did a wonderful job. One problem is that when people got insurance, whether it was Medicaid, commercial, Medicare, we couldn't see them anymore at the free clinic. So they graduated out and we didn't often get to see what happened to them once they had insurance. At Blue Ridge, when people have a change in their insurance, if they get insurance, if they lose their insurance, we still see them. And so I've been able to firsthand see folks who have gone from having limited access to care. We can take care of their basics regardless of whether or not they can pay, but some things are outside of people's reach if they don't have insurance. And so rather than telling some more of the very compelling and gripping stories about what happens when people go without, I want to tell you, I don't know how much time we have here, but at least one example of when the system worked right for somebody. Imagine a family breadwinner who is in the gap where the family doesn't earn enough to qualify for insurance exchange subsidies, but they earn too much to qualify for Medicaid in our state, as the laws are. This person lost their job and lost the insurance that they had with the job, so they started doing odd jobs, working as an independent contractor, had a back injury, and suddenly wasn't able to work as much, started suffering from depression. You know, it's a downward cascade we can all see around us. This person, to make a long story short, got Medicaid, and it was amazing seeing how things turned around for them. They had been foregoing care at a spine surgeon because they assumed they'd never be able to afford the surgery that they thought they needed. And that's a huge problem, is that so often we have no idea what our care is going to cost when we enter into it. So it's terrifying, because if it's a big open-ended question mark, is this going to be another house mortgage, or is this going to be a house payment, or is this going to be something that we can manage? In this person's case, we were able to refer them to a spinal specialist, and lo and behold, this person was not deemed to need back surgery, and instead was able to get in the office injections that totally made that person able to start working, got back to work again, had a huge positive effect. So often healthcare costs way more than we think it ever will. But sometimes just getting in and finding out, at least getting some information, Medicaid allowed that person to get back on track and actually cost a whole lot less than they thought. Imagine that. So that's not all the stories are happy, they're not always good, but it's just that glimmer of hope is what we have to go for. And we have that now. So again, thank you all for being here tonight, and look forward to seeing progress on this issue.
I'm going to stand up because this is a topic that I am so passionate about. And I don't know if enthusiasm is the right word, but I know each and every one of you feel my enthusiasm and want Medicaid in North Carolina expanded. First of all, let me say that I am honored to be on this stage with such a fine panel, and thank you for sharing your experiences with us. I can't help but think about the last time that I was on this stage. It was last September. Down Home was doing a forum for the House candidates in this district that included Haywood County. So I shared this stage with Josam Queen. His former opponent, Mike Clampett, decided not to participate. My opponent, your representative for the fourth time, shared this stage with us. A lady from the audience stood up and asked Representative Presnell a question directed at her personally. The lady asked her a question that I thought was easy, that I thought that she would be able to answer immediately. The lady asked her, do you think healthcare is a right or a privilege? Representative Presnell couldn't answer it right away. She kept saying, that's a hard one. I don't know. I could feel my heart beating out of my chest. When she finally answered the question, she said, I guess healthcare is a privilege. I gasped, the audience gasped. But the lady in the audience that was asking the question pressed her even more and said, well, if healthcare is a privilege, who is privileged? Am I privileged? Are you privileged? Representative Presnell replied and said, well, I guess if you have a job, you're privileged. Now people, I don't know about you, but I know a lot of hard-working people who have jobs who don't have health coverage. I'm going to put the way my heart felt that night and still feels aside, and I'm going to use my head. And I'm going to tell you some facts. So if you'll pardon me, I'm going to read some facts about what not expanding Medicaid will do for Haywood County. By not expanding Medicaid, Haywood County, and some of these numbers have already been expressed, Haywood County will have over 1,000 fewer jobs created by 2020. And over 2,500 fellow Americans who would have health insurance will have not gotten Medicaid coverage. By not expanding Medicaid, Haywood County will have over $35 million less in growth to the county's economy and over $54 million less in county business activity. Haywood County will lose over $767,000 that could have been collected by county tax revenues, and that's all just since 2016. If North Carolina does not expand Medicaid, our state will end up losing $21 billion in federal matching funds, which, this has already been said, but it stifles our economy and employment growth. Expansion will not only help more people get access to health care coverage, but it will also serve as an engine of economic development and job creation. Statewide, about half the jobs not created would be in healthcare, such as hospitals or clinics, and almost half would be in other sectors such as construction or retail and wholesale trade. This ripple effect occurs because Medicaid's funding received by hospitals, clinics, or pharmacies is used to pay workers' salaries and to buy other goods and services. These economic benefits multiply as funds are in turn used to pay mortgages or rent, buy food, and pay state and county taxes. But people, let's face it, expanding Medicaid is just the morally right thing to do. Our communities, our state, and our country is at a moral crisis. It is high time, it's past time that we start helping our fellow neighbors and expand Medicaid in North Carolina. Thank you.
All right, so Rhonda is exactly right, and it doesn't have to be this way. And before this event, thank you guys, look at this teamwork. Before this event, we actually invited our legislators to come out and share how they feel about Medicaid expansion with us. and to share their stance with us so that we could have a little bit of peace of mind, knowing that the folks in Raleigh would be looking out for us, right? Big surprise, we got one response, and it was from Joe Sam Queen, who has currently sponsored a Medicaid expansion bill. And the other three folks that we invited, Representative Michelle Presnell, Senator Jim Davis, and Senator Ralph Hayes, didn't even respond to the emails that we sent. So, and you can see all of their faces on the back of your program if you hadn't noticed that yet. If you want to put a face to those names. So the letter that we got from Joe Sam Queen that I would like to share with y'all, we would share all of the statements from all of the representatives if they had sent us one, but this is the only one that we have. This is what we'll share. Joe Sam says, "Good afternoon. Thanks for attending this town hall and an incredibly important topic. The quickest, most sensible way to close the coverage gap and provide health insurance to 500,000 of our state's low-wage workers is through Medicaid expansion. It will not cost us a single penny in new taxes. If we truly want to be a fiscally responsible state, we will expand Medicaid now. We will save $4 billion every single year, create more than 40,000 jobs, and see an average 7% drop in healthcare costs for everyone, regardless of where your insurance comes from. Every year that we have delayed this smart policy, we are wasting tax dollars that we already pay, and we lose jobs." Joe Sam has been glad to see bipartisan support for Medicaid expansion in the General Assembly this year. His Republican colleagues have proposed their own Medicaid expansion bill, which he was pleased to see. He does have some current concerns, however, with the work requirements, the premiums, and the co-pays that they included in their bill that would cause delays in coverage taking effect and reduce access. But it is a step forward on their part. More than 2 months ago, Joe Sam co-sponsored House Bill 5 along with 55 of his fellow representatives. House leadership has continued to obstruct, and our bill has yet to see a vote. He is confident that it would pass today if it were simply allowed to be heard on the floor, but they won't even let it get that far. Our bill would go into effect in November of this year. The Republican bill would require federal waivers for the exception of premiums, co-pays, and work requirements, which would delay its implementation until after the 2020 election, resulting in another entire legislative session wasted for health care. It's time to expand Medicaid. We cannot afford to kick the can down the road past another election. We can cut opioid deaths, create jobs, and increase positive health outcomes this year. That is what we need here in North Carolina, and 2019 is the year to finally get it done. So that is from Joe Sam Queen. Unfortunately, like I said, I don't have any statements to share from the other three representatives and legislators that we invited to attend this event. However, we do have some insight onto where they stand. You can see on the back of your programs that Jim Davis, we've had multiple meetings with, and he has said that he does support Medicaid expansion, but only with work requirements, required drug testing, and premium payments. So that is something to take into consideration. We're going to talk a little bit more about this in a few minutes, but for about 20 minutes, we actually did want to open up the floor for y'all to share any comments, ask any questions of any of the folks that are here today on the panel or from down home, and in general, just like share your experiences and your concerns. So it'll be first come, first serve. Leslie.
This is my son, Michael. He was born on my 22nd birthday on November 3rd, 1974. He had a birth defect. We didn't know then that that would be a death sentence later down the road. When he was 19, he decided to take a year off college. That, too, was a death sentence. He couldn't get insurance after that because a birth defect is a pre-existing condition. And so he couldn't get the screening tests he needed. The doctors demanded $2,300 in cash, which as a student he did not have. And so he died. They knew it would happen, they let it happen. This is America today. This is North Carolina today. This is a refusal to allow people the dignity of decent health care. This is criminal. Not just immoral, it's criminal. And when I went to tell legislators about it, Chuck McGrady asked me the same question that most Republicans ask me. And I know this isn't supposed to be political, but these are the people who ask this question: was he working? I asked them whether they can recall Congress passing any kind of law mandating the death penalty for unemployment, because I certainly was not aware of it. His answer, as is the typical answer from everybody who asked that question, was, well, some people just want a handout. I tell them that there is no such thing as a health care handout. Health care is a basic human right. If you don't think that way, then you don't stand for basic human rights. And do you know what we call people who don't stand for basic human rights? The term is fascist. And I'm done with it. I promised my son 11 years ago on his deathbed that I would fight every day of my life for health care access for every single human being in this country. Everybody, no exceptions. And we're no closer now than we were. I mean, we're a little closer, yeah. But the Affordable Care Act has been undermined. I've been a navigator, and last year, a woman came wanting insurance for her 32-year-old son, who was a year younger than my son was when he died. And he worked part-time. He couldn't work full-time because of health issues. We could not get his income up to where he would be eligible for a subsidy. I had to tell this mother that there was nothing for her child. She started to cry and she said to me, "Do you know my boy's gonna die? Do you know how that feels?" And I had to tell her, yes, I do. And I had to stop being a navigator because I can't do that again. We've got to expand Medicaid. We've got to be more human. We can't allow these people who would see us die to get their way. If we can't get a Medicaid expansion this year, they can't keep their jobs, and we have to make sure that's true. Thank you.
Questions, comments, concerns? I know that one's a hard one to follow. Good luck, y'all. Questions? I have a question. Yeah.
Who do I direct the question to? You? Okay. The opponents of this have said that for so many years we get the matching funds, but the matching funds run out after a certain time. So what are the reservations that they state, other than we want people to work? What are the reservations and the concerns so that we'll know the full story of what the opponents, we need to understand what they are saying. So what are those basic points that they are opposed to the expansion?
Yeah. So the question is, what are the anti-expansion talking points so that we know how to counterpoint those, right? So Leslie, you had sounded like?
I know the answer to this.
Take it away.
I have read the Affordable Care Act cover to cover. You can ask me anything about it, I might know. But what happens is Medicaid expansion for the first couple of years was 98% covered by the federal government. That subsidy will decrease to a low of 90%. The most that our state will have to pay for Medicaid expansion is 10% of the cost to cover 500,000 lives.
And let me add to that with expansion, the number of jobs that'll be created with even the 90% of federal money that will cover 90% of the program, when you take into account the number of jobs created and then state income tax that those people will pay, instead of not having a job, they'll now have a healthcare job, making $20 an hour or whatever, or get trained to do something really useful for society, they'll pay taxes, which will more than make up the 10% by all accounts that I've heard. And that's been the experience in other states, Montana, Ohio, Kentucky, where They've had Medicare expansion Medicaid expansion for more than 3 years. The revenue that's being generated, thanks to the sharing of federal funds, has more than compensated for 10% of the state burden.
Also, another part of what you asked was, what are their arguments against it? One of the points is that they want people to have a buy-in. They don't like people having a handout. Well, one of the buy-ins is that people will get health care, get preventative health care, and will get healthier, which will bring down health care costs for everybody. That means that people will not have to pay more, and the people who are getting insurance and are taking care of themselves will not have to pay more, and their premiums will go down. So if we can tell them that the buy-in is not that they have to pay premiums or that we want work requirements, but it's that people will go to their doctor regularly, they'll get their regular checkups, they'll take their kids to the doctor regularly, everybody will get mental health care, their regular health care. That's the buy-in. We want people to be able to go to their doctors regularly, get preventative care all the time. So that's one of the things.
Steve, have you seen, do you have evidence of healthcare costs going down too when Medicaid is expanded?
Yeah, the Kaiser Health Foundation really covers this very well. You can go to their website, Kaiser Family Foundation, and they've got all the stats, including the stat that the national experience has been that over 60% of people in Medicaid expansion are already working, and of the remaining 36%, about 30% are caretakers or have disabilities and can't work, or taking care of sick people in their home. So they can't work, so they're exempt from the work in other states, leaving less than 10% of people who are sort of in this marginal thing that's thrown out there like getting something for nothing. And I'm sure even that 10%, if you kind of delve into it, people have got stories. There's a small percentage of people that take advantage of every system. Duh. Most of them are in Congress or
Yeah.
most of them not in Congress now.
Just to add to that too,
But the whole thing about, they're getting something to nothing. They're working, they're disabled, they're taking care of people in their home as caretakers for elderly, sick people.
That's right.
Are they being paid, Steve?
Sorry?
Are they being paid, those caretakers?
No, they don't even get Social Security. It's like not a real job, No, this is like family caretakers.
On other insurance policies, though, caretakers in the home taking care of family members do get paid.
Oh, wow, that's great.
And just to double down on that too, so the the responsible argument, if they're saying they are pro-Medicaid expansion, but they want people to have skin in the game by working, etc., it actually costs more money to do all of those reporting requirements, to have people come in and report that they are working that much, and to collect the 2% premium costs more than it even brings in. So that's an additional talking point. And I'm gonna let Kathy go ahead and ask hers, or make her statement.
I have to respond from a couple of different directions. Number one, as most of you can see, I've got some significant disabilities. I've got cerebral palsy. I'm also legally blind. I was one of the first people in New Jersey on Medicaid in 1974. So yeah, I was one of the takers. Well, guess what, folks? That's what kept me alive while I got my education. I subsequently went on to have a 38-year career in social work. So I think to assume that people who are on Medicaid are takers is absolutely bogus. Number two, until we, God bless it, get universal health care in this country, we need to be ashamed of ourselves. And then my question is, based on my experience as a social worker in New Jersey, one of the only problems that we had with the Medicaid expansion, and by the way, we do need to be ashamed of ourselves, because as bad a governor as Chris Christie was, at least he had the sense to expand Medicaid. Anyhow, that's my little editorial comment. My question is, and perhaps our healthcare professionals can answer this. In New Jersey, we did have a problem once Medicaid was expanded in having enough docs who were willing to accept Medicaid patients because the payments were so low. What can be done to alleviate that problem once Medicaid is expanded in North Carolina? Thank you.
Actually, Governor Cooper and Mandy Cohen are taking care of this issue. Medicare, which everybody can live to 65, as I have, you get Medicare. And doctors take Medicare because even though it's only about maybe 75 to 80% of Blue Cross, it's still significant enough that it's generally universally accepted by medical practices, hospitals, and so forth. Governor Cooper and Secretary Cohen are going to make Medicaid fees parity with Medicare, as retroactive as of January 1st this year. So that's a huge step forward because yes, it's really true. As she was saying, many physicians cannot accept Medicaid patients or put a limit on it, even pediatricians in the state. My practice has never put a limit on Medicaid patients, and dentists especially, unfortunately. But there are many practices around the state, family doctors, internal medicine, OB, pediatrics, who restrict Medicaid because it's about 50 cents on the dollar, actually lose money every time they see a Medicaid patient. And the governor and Secretary Cohen are now stepping up and changing that, which would make Medicaid now much more acceptable to providers around the state.
Yes, Jane.
Well, I just wanted to point out that the NC Policy Watch from the NC Justice Center has an article out. Proposals to close the health insurance coverage gap should follow the data on what actually works. And one of the big points is that those that want to erect barriers like work requirements and things have actually had the opposite effect in the states that have already tried this. And in a case that was just recently decided, the Arkansas work requirement was declared unconstitutional and illegal. We need to make clear that it's a similar analysis of financial hardship that already makes it difficult for Carolinians in the coverage gap to make ends meet show that any requirement to pay premiums will further disrupt already precarious household budgets and force families quite literally to make the impossible choice of deciding between food on the table and purchase of health care. 2% doesn't sound like much, but if you already are running out of money before you're running out of month, it's an additional burden, and actually people have lost coverage in the states that have done it. It's basically another trick, I said, to cut more people off of Medicaid when you get back down to it.
Nancy's got something.
Okay, first of all, Rhonda, I'd love to have your statistics. You filled my brain with all kinds of numbers. I'll never remember them. The rest of you, I hope you have Jim Davis, Michelle Fresnel's phone number on your automatic dial. Call them, call them. Call them, that ties up their telephone line, okay?
Yeah, you can still get on Ralph Heise's nerves.
Yeah, I know. You just keep calling. A couple of years ago, several of us, or a lot of us, did a lot of canvassing with healthcare brochures in front of hospitals. We need to do more to let everybody in Haywood County know. I'm one of the ones that's out in front of the courthouse on Wednesday from 12 to 1 with signs, all kinds of signs. I have signs about Puerto Rico, I have signs about this and that and the other. Come and join us. If you don't have a sign, you don't want to make one, I probably have one in the trunk of my car. What's the car? 12 to 1 in front of the courthouse every Wednesday. All right, now the other thing, I have a friend in Missouri. They did a die-in in front of their courthouse with signs, RIPs, and everything else you can imagine. We need to get a lot of whatever you want to call it, attention, media. Think about how we can present this, because people hear you, they read it in the paper, they may hear it on TV, but you got to do something to, get to them immediately. So whether Down Home wants to do it or not, that's what I think we should do.
I have poster board gravestones if you need them.
That's right, RIP, and they laid down, people with wheelchairs came, everything you can think of to do, bring it to the public attention, because that's, Steve, don't you agree?
Yes.
Yes, we've been out in front of Food Lion, we were at Walmart, we were in front of Big Lots and hospital with all kinds of brochures. I can't remember these numbers. And I get ready to call and if I have talking points in front of me, I'll call every day, just keep calling. I'm so-and-so and I'm from so-and-so. Please get your numbers on your speed dial. I've got Tillis and Meadows and Burr and Jim Davis, Joe Sam. I'm not in Michelle's part, but do that, call them, let them know, because if you don't let them know, they're gonna think everything's good.
Okay, thank you. Ed?
So, can you hear me? Do I need the mic?
Does he need a mic, or can y'all hear him?
Okay, so I volunteered to write a letter to the editor of Down Home supporting expanding Medicaid. And actually, one of the sources that I found that was very helpful in writing that was the Kaiser Foundation report that Dr. Wall recommended there. That is they are summarizing over 220 reports where they have studied what has happened across the country, both in states that have expanded Medicaid and those that haven't. And there's a lot of statistics in there. So what I did in that letter was to boil that report down to 750 words for my letter to the editor, and I meant to bring a copy of that with me. But if anybody's interested, if you ask about statistics, a lot of the statistics are in there. Let's say I boiled it down to 700 words, so you don't have to go through this big long report. So if anybody's interested, give me an email and I'll send it to you.
Can you put in the...
When will that be in the paper?
It's in the paper already.
It was in the paper last week.
If your email is on the sign-in sheet, I will send you a link to that letter to the editor. Sound good?
Well, and actually, the way I had it formatted when I sent it to the letter to the editor was a lot easier to read. When I looked at it in the paper, I thought, my gosh, did I write that? It looked terrible. Okay, so I can send it to you in a format that's much easier for you to get the information.
Perfect,
It
thank
makes
you.
a lot more sense.
Good.
I can even read it that way. I can probably read one in the paper myself.
Great. In the far part?
And we can't forget about social media, Facebook. We all have those friends, so.
That's right. And this event is being live streamed on Down Home's Facebook page. So follow us on Facebook, share this event. We'll also be sharing talking points. That helps us spread the word immensely. Word of mouth and networking is the most valuable way to spread the message. Great point. Thank you. Someone else have their hand up?
Chelsea, can I make a comment?
Yeah, make a comment.
I think a really scary and important issue is that President Trump, last month said, that's it, we're going to do away with the ACA. Then 3 days later he said, no, we're not going to do it. We'll do it after the election.
Mm-hmm.
Well, what does that mean? It means attacking the Medicaid expansion, which is ACA, and then he's going to go after Medicare as well with the budget, which he couldn't pass this year because, thank God, we have representatives who will not pass this budget. But after the election in 2020, he has vowed to dismantle the ACA, and his budget proposal, as you all know, cuts $1 trillion, some unbelievable number over 10 years of where we would be. And then they say it's not a cut, it's just slowing down expansion. Hello? So 10 years from now, we'll have $1 trillion less than we're supposed to have for all these programs. 2020.
You want to say something?
I want to say something about that. He has a nerve to ask us for money to build his wall, but he can't give us proper health care. He doesn't care about our people. Oh, there's a shooting there. Well, yeah, that happens all the day. What? If you don't care about your people, you don't deserve to be president. You don't deserve to be all high and mighty, sit up eating hamburgers, whatever. Sorry, Saturday Night Live, love it. And if you're gonna say, oh, I want this, I'm gonna get this no matter what, you might as well just put yourself with the rest of the hypocrites out there. I actually would like to say, I want a president that actually cares about my health, cares about the future generations of the children that are supposed to be here, cares about whether or not they're on the streets or making a living doing what most of us would actually wish that we could do. I want to be the next person to scratch out all these diseases that are actually coming in as the last ones are going out. Not sure what else to say though.
What's your healthcare situation like?
Well, I actually have Blue Ridge healthcare. I was on Medicaid until I turned 21. They said, oh, you're 21, you cannot have Medicaid because you should have a child or prepare for family planning. And that actually shocked me considering I did not have a job at that time. That actually hurt me a little bit because I'm not gonna go out, get pregnant, even though I cannot afford to take care of myself right now. And my grandmother, I'm actually a bit worried about her right now. She has type 2 diabetes. She cannot afford insulin, which they're asking $300. So what she does is she gets the samples and she uses those. And knowing what happened to my great-grandmother, she died when she was 96, and she died in the hospital. It pains me to actually think about how that happened. Yeah, she was sick. Yeah, she was at... I don't think I knew her for a full 10 years yet. And so now every time I pass that hospital, knowing that I live close to it, I can't help but get mad that no one actually did what they could to help her. And now the only family I have left is really my grandmother here in Silva. Well, not Silva, we're in Haywood. But the closest family I have after her is in Durham, and I know they're busy taking care of 2 different families. Any other family I have, Missouri, Ohio, Washington State, there's not many people that I can actually turn to when something goes wrong. And I don't want to have to go to another family funeral. Families are drifting apart, people are getting mad at each other, and they're closing doors. I don't want that for the future. I want a country that cares for each other as much as they care for themselves. So this expansion on Medicaid, I think it will help everyone from the East to West Coast, maybe even other countries. Because if we're better with our health coverage, maybe the world will actually see that they can actually do something similar too.
All right. Any other questions, comments, stories we want to share? Cassie's got one.
Okay, I'm really bad at public speaking, so sorry in advance. Well, I came back down here from New York, and I had insurance up there, but hadn't been able to get it back. When I've been down here, and it's just like really hard to try to do that and live in another state and then come back and it not be available.
Did you have Medicaid?
It was called United Healthcare, and but it provided pretty well. There was some stuff I couldn't afford, like when I needed like prenatal vitamins, they were gonna charge me like $100 and something for it, and then test the doctor had to run, he charged me like $159, and I didn't ask him to do it, but he just, he did it and then charged. That was up there. But yeah, down here, I'm not currently employed. I've been looking for a job, but yeah, I'm not sure I'm going to be able to get it here. So expanding it would definitely be, very beneficial. So yeah.
And if you had to prove that you were working in order to have it, but you're looking for a job.
Yeah, it's like not even.
Yeah. Thank you. Good job. All right, y'all, if there aren't any other questions, we have one more thing to do before we're gonna leave. So I see some folks leaving, but I'm calling y'all out. Stick around. Ready?
All right, y'all are asking some great questions and making some great points. And I think we can all agree on one thing. It does not have to be this way. It just doesn't. And from personal experience, I would never want anyone to experience what I have gone through, and I have heard some horror stories, and there are so many out there, folks, it really doesn't have to be this way. And what people call young at 45, and for the last year I felt like I was, I don't know, not 45, that's for sure. But I absolutely agree. That's why I'm standing here. So yes, one more time, it does not have to be this way. And we know that the folks that are writing the rules, they're not gonna do the right thing unless we raise our voices, hold them accountable, and say loud enough, we demand health care. We demand Medicaid expansion. So that is exactly what we are gonna do here tonight. Let me hear you one more time. What do we want? Healthcare! And when do we want it? Now! That's right. Great. But the real raising our voices involves getting in touch with our legislators, especially all the ones that refuse to respond when we ask them about this issue that should be their top priorities. That includes Michelle Presnell, Jim Davis, and Ralph Hayes. These folks are supposed to fight for us, but they won't even respond to us, and that isn't right. And I know firsthand that happens is because I was in Raleigh several weeks ago and stood in front of Michelle Presnell and listened to her. And it was like talking to a brick wall. So I guess if playing nice doesn't work in the long run, maybe it's not time to play nice anymore. Maybe it's time to be real. I mean, I'm supposed to be held accountable for working and being a productive member of society. Okay, well, I'm asking for help. And you're an elected official. You're supposed to be helping us. And that includes me. Anyways, some of our volunteers are going to come around the room and pass out postcards. And I'm going to ask you all to take a few minutes to fill out that postcard. We will collect them and fill out the legislator's information. You just put the message that you want to send and your own contact info. If you have a smartphone and want to use this time to send an email as well, you will find their email addresses on the back of your programs. So if you just flip it back, it will list their email address below what they voted for, what they didn't vote for, or what they will support and what they won't support for Medicaid expansion. Also, all right, the postcards are coming around, and if everyone in this room fills one out, that's as many people who are here, and as many people that are here in United Voices that are telling our legislators to do the right thing. So we're going to take a quick break and let you guys fill these out, but please don't leave yet. We have one more thing on the agenda, and we'll come back together in about 5 or 10 minutes. In about 3 minutes. Yes.
I may be the dumbest person in the room, but I'm not sure which side of this you want us to fill out.
The blank side is where you write your message. And the side and you check the boxes to ask them what you want. And the side with the lines is where we will put their address. Your message goes on the blank side.
Your message goes on the blank side. And the boxes you check are the boxes that you want them to respond to. And sir, just so you know, there is never a dumb question or dumb action, because when I first got here, I put my name on the postcard because I thought it was a name tag. So it's okay. So don't feel bad, please. I suppose you could write any kind of comments you wanted to on the back. That's geared to our legislators too. So please, thank you. Take the next few minutes and we'll get back to you in just a few. Thank you.
If you need a prompt for what to write, a good one is, hello, my name is so-and-so. I live in blank town in North Carolina, and I'm writing you today because I want to understand your stance on Medicaid expansion, something that is one of my top priorities. Easy as that. I see some questioning faces. Everybody getting it? Hey, folks, how is everyone feeling? Do you need a few more minutes, or does everyone feel like they've completed what they need to on the postcard? Do this if you're good.
All right. Now that we've had a few minutes to write a message to our legislators telling them that healthcare matters, it's time to get to work. Tonight is just the first step. We won't see Medicaid expansion if we don't keep walking the path and holding our lawmakers accountable and following up to make sure that they're doing what is in our best interests. Thank you so much from Down Home, North Carolina, and all of the sponsors for showing up, because that is the first step, but we have to keep going. Down Home is working hard to turn this into a reality, but we can't do this alone. If you live in Jackson County, you can join us this Saturday at 4 o'clock for our Jackson County chapter meeting. We will be meeting at St. John's Episcopal Church, that's located on 18 Jackson Street in Silva, which is right across from the City Lights Downtown Cafe. Pardon me. Also, if you live in Haywood County, you can join us this Friday at 5:30 at our office here in Waynesville. That's located right next to Bocelli's. The address is 301 North Haywood Street. If you can't make it this Friday, our community meetings are always the third Saturday of the month at 1 p.m. So the next chapter meetings that I have that are also located on the bottom of your flyer are the Haywood County chapter meeting is Saturday, May 18th at 1 o'clock. And the next Jackson County chapter meeting, besides the one on the 27th, is May 25th. Again, those dates and addresses are located on the bottom of your flyer. Now, as we get ready to leave, we are going to take a big picture of all the folks that came out to stand up for what's right today. If you'd like to join us, hold up your postcard or your rally sign, and let's cheer while we take a photo.
I've got most of it. All right, y'all. Let me just fan them out.
Yeah, and just say, we want Medicaid!
We want Medicaid! Hey, when do we want it?
Now! Awesome. Thanks, you guys. Thanks for coming out tonight.
Thank you all very, very much. Have a great evening, guys.